Hey, I'm Megan, and for my disease presentation, I chose congenital sucrase isomaltase disorder, which can also be called CSID. And the reason I did choose this one is because our 2-year-old son, he does have this, and it's really helped me learn how to cope and learn different stuff to help him throughout his life. So it is a genetic disorder, and it happens when the baby is in the womb, and it is a mutation of the SI gene, which produces the enzyme called sucrase isomaltase. And without the enzyme, which is found in the small intestine, people with CSID cannot process simple sugars and starches. The symptoms can vary from patient to patient, but it is noticed more with infants once they're weaned from breast milk and formula. And some of the symptoms that they experience is chronic diarrhea, failure to thrive, abdominal swelling, gassiness, irritability, reddened buttocks, indigestion, and vomiting. And our 2-year-old son did experience most of these symptoms except the abdominal swelling, and it is often misdiagnosed for toddler diarrhea, IBS, celiac disease, food allergies, and cystic fibrosis. The treatment is dietary restrictions and meeting with a registered dietitian to help go over what the patient can eat and what they cannot eat, and different substitutions for sugars or starches. And also, there is a medication that is FDA approved, and it would need to be taken before each meal that the patient eats that includes sugars and starches. The only catch is it has to be refrigerated or kept in a cooler if you're outside of the home. And I know a lot of people have other symptoms after they take that, so a lot of people don't really enjoy taking that. The prevalence it's not very common. It's found in 1 to 500 to 1 in 2,000 people. It is seen more in Greenland Eskimos and native Canadian natives. But like I said, a lot of times it is misdiagnosed. And the prognosis would be changing your diet. And if you see changes in your symptoms, then you would have CSID. And then also further testing can be done like the 4-4-4 test, which is when a patient does 4 tablespoons of sugar and 4 ounces of water. And in 4 hours, if they see the symptoms again, then they would have CSID, as well as going in and having a doctor biopsy the small intestine and testing for the enzyme if it's missing. So overall, CSID is a genetic disorder. People will not outgrow it. There is medication that can be taken, but it's not ideal. And there is different testing that can be done. So I hope you learned a lot about CSID. Thanks. Bye.